Sometimes we'll see the kids, and then the parents will say, "Oh, do you see adults too?" And then they'll come in, and I'll be like, "Tim and I see you." And they're like, "Yeah, you saw my daughter, and now it's me." And I'm like, "Oh, such an honor." Like, really,
It
this is such a
is.
privilege. And to be able to help anybody with the expertise that I have in allergy and asthma so that we can breathe. And that's my goal, to help everyone do their thing, enjoy their life outside the office, which is why I always ask my patients, what kinds of things do you like to do? What are your activities? Because if you're a gardener, if you're a runner, if your kids play soccer and they're not able to do it, then it's my job to be able to help them breathe and enjoy those activities.
Absolutely. Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Well, hello, hello, hello. Hi, everyone. Welcome, welcome, welcome. Welcome to another episode of the Care Room with Dr. Cindy. So today I have a very special guest with me, Dr. Gina Dapul. She is joining us from Rockville, Maryland, where she has an allergy practice named Family Center for Allergy and Asthma. And I will tell you, as a mom myself who, has kids with asthma and allergies, she is such a great resource. So I'm so happy that you're here with us today, Dr. Gina. But before we delve into everything, I'm just going to let you introduce yourself.
Okay. Thanks so much for inviting me on, Dr. Cindy. So excited to be here.
Mhm.
So as Dr. Cindy said, I'm Dr. Gina Dapul. I am the founder and CEO of Family Center for Allergy and Asthma in Rockville, Maryland, in the Washington, D.C. area, where we take care of children and adults with allergies and asthma and help them to breathe better so that they can live their best life.
We love it. We love it. We love it. Thank you for what you do, because those kiddos, they certainly need wonderful doctors like you.
Hmm.
So, Dr. Gina, as a family doc, one of the things I commonly see is kids coming in, especially during, like cold and flu season. That's when, like their asthma tends to act up. But in, like pollen season, which I think we're taping now in January, that's coming up, correct?
Yes,
Yeah.
for sure.
Yeah. So, we're gonna be seeing a lot more of the allergies and, like the watery eyes, the runny nose. Can you
Nose, yeah.
tell us more of what to expect with that child who has allergies?
Yes. So that's a great way to start. And I think what's really important to understand is from the beginning, like, why do we have allergies to begin with? Right.
Sure.
So the way I explain it to my patients is that your body is overreacting to something that's harmless, right? Like pollen. And if you're allergic to things that are year round, that can be dust mites, cats, dogs, molds. And so the body is overreacting when it encounters these things, and we call them allergens when you do react to it. And so once we encounter this, the body says, danger, danger, when it's really not dangerous. It's like pollen outside. So the idea of recognizing that is telling yourself, wow, my body is reacting to something that's out in nature. And so you recognize with your kids, okay, my kid is reacting to something that's normally out there, and most people don't. But that's the idea behind it. And so recognizing that that's what's happening to your body, you can say, well, usually for some people, there can be a predictable pattern for this, right? Especially with the spring pollen season, we can say, okay, it's coming when the trees are blooming, weather's warming up. We say, okay, now we expect the tree pollen to be coming this time of season, usually anywhere from March, April, May, and June. And then actually after that, there's another set of pollens called grass pollens. They also start in the spring, but then they tend to peak around May, June, July. And
Sure.
then the last set in the local area too are weed pollens, and that typically peaks in around August, September, October. So, yes, this is what's happening, which is the body reacting to these pollens as they're out, and then it can start a whole cascade of symptoms that most of your patients and our general population can experience, which can be itchy, watery, swollen eyes, red eyes. Sometimes they wake up with little crusty things in the morning, but then also with the nose, it can be congested, stuffy, runny, sneezy, postnasal drip, and even causing some cough. And then for some patients who may have some asthma, which is the lower airway inflammation, then you can have coughing, wheezing, shortness of breath, and chest tightness.
Sure. Thank you for that. How you mentioned, so based on what you're saying, it's kind of like we can deal with allergies all year round, the different forms,
Potentially,
basically.
yes. If it's
Essentially.
year round or seasonal, yes.
Exactly. And then, so how do we differentiate? Like, how would a mom know? Okay, this is allergies versus a cold, because they both present similarly, right? You have the runny
Yes.
nose. Sometimes you have the goopy eyes when they wake up in the morning.
Mhm.
How can they differentiate?
So that's a common question we get asked all the time because, especially now in the season that we're in January, we don't see any pollen at this point, right? Trees are starting to slowly come out. But the thing is your symptoms. So, yes, you can get very similar symptoms with your eyes and your nose and your breathing. But the timing of it is where we can say, is there an allergen related trigger to this? Or are we around sick people? And have there been others that are around us at school, at home, that have come home with brought home a virus or something? And so one of the some of the things that we look for to say, okay, this is likely a virus, is that if there's a fever, that's more likely a URI, upper respiratory infection, or a virus. If there are muscle aches, joint aches, like we're just feeling really, really achy and down, that's usually also likely related to a virus. And typically, viruses do go away anywhere from, as you know, 5 to 10 days, maybe 14 days. It does its thing and it goes away. But allergies can actually linger much longer than that, especially if it's an indoor allergen that you're being exposed to at home, whether it's pet dander, dust mites. So if it's more than 2 weeks and you're like, wow, this stuffy nose and these watery eyes and itchy, all this irritation is still there, and there's no fever, there's no muscle aches and joint pains and nobody's sick, then we can start to think, wow, could this be an indoor allergy issue?
Got it. Got it. Okay. Guys, you heard that, right? So the infections tend to have more, I guess, body aches, fevers, systemic symptoms. Okay. So Dr. Gina, so we talked about, what allergies are. We talked about what they will look like, how you can kind of figure out as a mom, maybe something going on here. Can you talk to us about if our child gets diagnosed with allergies, what treatment looks like, what the
Okay.
future looks like for that child?
Yes. How is it going to be for my kid who now has these, what looks like allergies? So, one of the things I would recommend is definitely speaking with your doctors and providers first to get a sense, is this allergies? Because what we can do if you're able to see a specialist like myself is actually identify what that allergen is. So, a lot of the times, we're guessing as parents, right? And we're like, we think it is. Then we go to the store and we buy some over the counters and
Right.
see, does this work? Has this worked? Oh, no, that one didn't. We're going to switch it up. Or that one worked. It started to, and then it stopped. So that's what's happening now because a lot of our medicines are now over the counter, right? We
Sure.
can buy them without prescriptions. But it's almost like playing a game of, well, what is this? Right? And so, because of my specialty, what I'm seeing, especially in recent months, a lot of patients coming and saying, I've kind of guessed that I've had this, but I've had it for, 20 years. And they're coming to me when they're in their 40s and like, I've never actually found out what I'm allergic to.
Got
Right.
it.
And so, if these patterns are always there, it's almost like you're going to keep continuing to do this. And so some patients have been on certain over the counter antihistamines for decades, right? They'll
Wow.
just come to me and say, I just keep getting, going to Costco and getting the antihistamine and using the nose spray, but never understanding exactly, well, what are you allergic to? Number one. But then also, how can we treat that in a more customized manner?
Sure.
Right? So yes, my, recommendation would be you can speak I would definitely speak to your doctors because you would advise them, okay, maybe we can try some nasal steroids or antihistamines or saline sprays. And then antihistamines by oral, if that's something helpful for the child or the patient. So yes, you can try over the counter things first, but it's almost much easier to go to your doctor directly and say, okay, what are your recommendations? Because there are some things that are available over the counter that we don't encourage to use for long periods of time. And sometimes when patients are not aware of this, it actually does more harm by causing more problems. So the example there is something like a nasal decongestant, such as Afrin, right? So this is available over the counter and it's in small print, but it says you can only use it for 3 to 5 days. And then we know patients who will use this for weeks, for months, for years at a time, that is actually causing the nasal congestion to be worse. So, I just caution everyone to say, look, are these medicines good for me? And really speaking to your doctors, your providers to say, is this a good option? Instead of just kind of guessing on standing in front of the allergy aisle and looking at all these options.
Got it. Got it. And that totally, totally makes sense. So we do testing. So what does testing look like? Is it painful for kids? Moms would, is it expensive for moms?
Yes. No,
All
this
the
is
details that the moms are would like want to know. Is it worth it to
yes,
get
yes.
them tested?
It's worth it. Yes. So the idea behind it is actually little plastic scratches. And when I explain that mechanism of allergies to our patients, then they understand, oh, that's why you're scratching me with these little plastic things. It kind of look like a caterpillar if you do it with more than one at a time, or if it's single scratches, they're like little plastic things that we kind of scratch on your skin. And the normal test that we typically do is called a skin prick test, and so it's plastic. And so how I recommend to parents and moms to tell your kid is really kind of prepare them to let them know, okay, when you go to the doctor's office, they're going to do a little scratch test, and you can even grab a pen and just kind of scratch it on the skin, on your skin, and I practice with it, and you're like, oh, that's what it'll feel like. Certain practices like myself, we do a panel, so you actually don't feel 10 things at a time. You actually just feel it all at once. We rock it back and forth. And then, we wait 15 minutes. But I always really try to encourage the parents to prepare the child because there is a lot of anxiety behind it, right? So you're wondering what's going to happen when I go for this allergy test. And, for my patients on our reminder emails and text messages, we actually have a little link that goes to a YouTube video that I made so that they can actually click on it and watch exactly what these little devices look like and how we wipe the skin down with some alcohol. So that really helps to decrease the anxiety. And so if you don't have access to, looking at your doctor's videos, it's almost like, well, at least I can tell my child, okay, this is what you're going to expect. It's like a little caterpillar on your arm. And then, oh, it's plastic. And then we wait 15 minutes.
Well, thank you. Thank you for explaining that. Is there any
Yes.
cost associated with it? Does insurance cover the testing typically? Yeah.
Yes, yes. So typically the insurances cover the tests and we have different panels in our practice. If we're looking for, just a small amount of allergens, we have a little panel of 10. There's an intermediate panel, and then if you've really suffered from allergies for many, many years or decades and you're interested in a more long-term therapy, we do have a bigger panel that incorporates all the different pollens that are in our local area. So
Got
yes,
it.
covered by insurance for most of them depending on your deductible and where you're at in the year.
Yeah,
But yes, so
absolutely.
it's doable. It's, a little uncomfortable. I wouldn't say it's pain free, but the results are within 15 minutes. And it's super helpful to really see it with your own eyes that, oh, that's what I may be allergic to.
Got it. Got it. And your practice offers allergy shots, right, Dr. Dapul?
Yes, yes, for sure. That is actually a long term treatment option.
Okay.
And surprisingly, many people don't know this, but it's been out for over a century. So
Okay.
over 100 years. This is nothing
Wow.
new, which is why it's tried and true. And yes, the idea behind it is giving patients what they're allergic to in their own vials. So if you're allergic to things like pollens, pet dander, mold, dust mites, this is made specifically and customized for you. And then we give it to you in increasing doses. There's different protocols out there. And once you get to this top dose or what we call target dose or maintenance dose, then it's a once a month therapy. So it's a long term option. rather than just taking any of these tablets, liquids, eye drops, nose sprays, all the things.
How long is that process for the allergy shots?
So actually, there's what we call there's two phases. There's a build-up phase. So it takes a couple months to get to that point. And then there's what we call a maintenance phase. So when you reach that once a month, it's about 3 to 5 years from there. So it's not
Okay.
forever. Three to
It's not
five years.
forever. And then at the end of it, it's kind of like you're back to, well, you're able to tolerate that allergen, correct?
So, yes, how I describe it is that there's no cure for allergies,
Right.
but it's the closest thing to a cure because we can actually train your immune system to not overreact when you encounter these allergens in the spring, in the summer, in the fall, or year round. And so, for me, it's so satisfying to see how patients were before they started shots. They came in with swollen eyes and they can't play outside. We're writing school letters, right, to
Yeah,
the kids at school saying, keep them indoors during high pollen count days. And you're like, so we go from that
that's neat
to
stuff.
being able, yes, being able to play soccer and be outdoors. And for even parents who are like, oh, I have to be on the baseball field for my kid or, all their activities outside, even parents are like, I can do this now because they're on a more longer treatment than just short term relief with medicines.
Absolutely. And can you walk us through, like, for we heard about the allergy shots, but we're like, I don't want that. I need something right now. Can you walk us through like a stepwise treatment plan? Yeah.
Yes.
What's typical?
So it's really dependent on what the patient's symptoms are. That's the predominant symptom. So most of the time, it's usually nasal or nose related, right? We're congested, we're stuffy. A lot of people, I'm sure, will say, I carry tissues with me all the time, right? And we're just going through a box of Kleenexes. Somebody actually told me a couple weeks ago, they're like, I should have invested in Kleenex because I buy so many tissues. But the idea there is, yes, so if your symptoms are primarily nasal, then now the recommendations really are to go straight to a nasal spray.
Okay.
And there are different options there. So things like nasal steroids, such as Flonase, Nasacort, Rhinocort, Nasonex also, and these are mostly over the counter now. Now you also have antihistamine nasal sprays. So they're not steroids, but they're also good for congestion, but really much better for things like runny nose and postnasal drip. And if you have eye symptoms, there are eye drops that are out there. Some of them are now over the counter as well, like Pataday, Zatador, Aloe. And if it's a more systemic issue, like it's really eyes, nose, itchy skin, and all the things, then the antihistamines, which are more, oral medicine, whether it's liquid or tablet, can help kind of address all of that. So, the idea is which of your symptoms are the more predominant one? Do we want to just target that one locally? Because for some people, it's just their eyes. They're like, oh, my eyes get really, really irritated during when I go outside. So then maybe you just need eye drops. Why would you need a nose spray if you don't have any issues there? Or why would you need a whole tablet or liquid if it's just your eyes? So, yes, depending on your symptoms, you have the options of nasal sprays, eye drops, and oral medicines. Oh, but other options too. If people are willing to try, they do have nasal saline sprays and nasal
Mm,
saline rinses and washes. So again, it's salt water. So there's no medication in them.
right.
So you can try to use that to flush things out too.
Okay. Thank you, Dr. Gina. Thank you.
Hmm.
Do you mind throwing out some common names of the antihistamines for the parents out there? Yeah.
Yes. Um,
Because we hear it all the time, but we're like, okay, which one is better? We know they're all
yes.
the same, but
So the second generation antihistamines are the ones we typically recommend. So that would be something like Allegra, which the generic name is fexofenadine, Zyrtec, which is cetirizine, Claritin, which is loratadine, and then Xyzal, which is spelled Xyzal, is levocetirizine. And some of these tend to make patients more drowsy than others, things like Zyrtec or Xyzal. So you may want to consider giving it at night. Or if you notice, oh wow, I gave it in the morning to my kid, and they're like kind of drowsy and not wanting to go to school, you're like, oh, that's the one that Dr. Gina mentioned should be given in the evening. So,
excellent.
yes, those are good second generation antihistamines that you can get OTC. And of course, if you've exhausted all those, which many people have tried, right? You go from one to the other. You're like, I've tried all of them over the counter already. Then that's when I would say see your physician, your allergist, because there is still a prescription version that we can prescribe.
Yes, perfect. And then I often hear moms come in, I tried Benadryl, and then you kind of have to explain like that's more for like a anaphylactic kind of or can you
More
explain
severe
when
reaction.
they should use the Benadryl? Because that's a
Yes.
common one for kids.
Yes, definitely. And so Benadryl, if you had talked to me like a few years ago, I would have said, okay, let's use Benadryl with the other antihistamines for allergies. And now we are shying away from these. These are called first generation antihistamines because there's the potential that it crosses the blood brain barrier. Right. So it goes into your brain, which is why it makes us like sleepy. And that's the side effect. But now there's some data to suggest that as we get older, it may affect our cognition and our thinking. So we're now really cautious on, recommending Benadryl in general, especially if it's something that, your allergy symptoms typically last more than a couple hours. So at least the second generation ones will last 24 hours around that time frame so that you get longer relief, whereas Benadryl and the first generation, they typically only last about 6 to 8 hours, so you find yourself having to take it more. So does that answer a question about the Benadryl?
It does.
Okay.
And then the other question I get a lot is, like the younger kids. Like are there age limits on the medications that they can, take, and how young can you start something?
Yes. So the labels do have a lower age limit, but that's why I recommend things even like nasal saline spray because you can start that, even before the recommended age limit for antihistamines by mouth. Some of the nose sprays do go down to as young as 4 years old, so you can try that. But that's why it's really worth speaking to your doctors before you try something that you're like, oh, it's really appropriate for 4 and up or 6 and up, so that you can hear from somebody with expert advice to say, is this okay to give maybe short term or not, before we start giving it on a more consistent basis.
Perfect. Perfect. Thank you for helping with that.
Hmm.
So, Dr. Dapul, can you tell us more about your practice?
Oh, yes, would love to. So, actually, I have been an allergist immunologist for about 13, 14 years and have opened my own here in the Rockville, DC area in September of 2023. So, we are a little bit more than 2 years old. And, I'm super excited about this practice because actually I live in the community and I serve, my friends, my children's classmates and my fellow moms. And it's really an honor to be able to, serve people who you see need your help and your services. And so, even seeing patients out in the community when I see them at the stores, it's such an honor when they come up to me and say, oh, or what's been happening because of the, pandemic, people will finally say, oh, that's what you look like without the mask. Right. So, I still tend to wear it just because we just never know, especially for us. We see respiratory issues all the time. And, I need to stay healthy for myself, my practice, my family. And so, yep, I have this on pretty much all day long.
Okay.
Unless I'm here in my office. But
Right.
yes, so the idea of really helping families, and for the most part, too, sometimes we'll see the kids, and then the parents will say, oh, do you see adults too? And then they'll come in, and I'll be like, didn't I see you? And they're like, yeah, you saw my daughter, and now it's me. And I'm like, oh, such an honor. Like, really,
It
this is such a
is.
privilege. And to be able to help anybody with the expertise that I have in allergy and asthma so that we can breathe, right? Because this is our one life. And that's my goal, to help everyone do their thing, enjoy their life outside the office, which is why I always ask my patients, what kinds of things do you like to do? What are your activities? Because if you're a gardener, if you're a runner, if your kids, play soccer, or, the student plays other sports and they're not able to do it, then it's my job to be able to help them breathe and enjoy those activities.
Absolutely, absolutely. And I'm sure your community is so, so grateful for all you do. I
Thank you.
100% believe that. So where
Thanks,
where
Dr.
can we find you online if we're not in the Maryland area? How can we
Yes,
find?
so you can actually find me on the web. Our web address is dapulallergy.com. That's DAPULALLERGY. But you can also follow me on Instagram and Facebook at drdapul. DAPUL.allergy. And yes, so I post, on Instagram and Facebook some of the tips, especially once pollen season comes in, we'll be seeing a lot of posts about that. And yeah, all the things, even behind the scenes to our practice and our office. So yeah, follow me and like, subscribe, and YouTube too. for drdapul.allergy.
Okay, perfect. Guys, you heard it. We want to thank Dr. Dapul for her time today and her wisdom. I know it'll be helpful for a lot of moms out there with babies who have, and when I say babies, older kids with
Others.
allergies, and even I know we touched on asthma a little. We'd be happy to bring you back for, another episode, a full episode on asthma, because I know another big one. But
Mm-hmm,
Dr.
for
Kapoor,
sure.
thank you. Yeah, it is. Thank you for your time today. Guys, I will have another awesome doctor here with me again next week. But until then, take care. Bye.
Thanks, Dr. Cindy. Bye.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.